Good afternoon to all the resilient diabetics out there. And if you're new to this channel, I welcome you. This is Jay Sampit again, and we are back at Dr. Brian Lum's office, and we'll be discussing scar tissue massage for diabetics. Basically the same thing as massage therapy because it involves muscle pain. The muscle pain that we as diabetics start to feel is a result of our medications, as a result of our age. Nobody really knows, but this is part of the therapy I go through. And as I mentioned in part 2, it really helps. Now, why is that so? I am going to do some correlations for you. And I discussed these correlations in the Does Insulin Make You Fat video. And what is that? Muscle, the more muscle I have, the more calories I burn at rest. The more calories I burn at rest, the more I get to eat. The more I get to eat, the happier I am as a diabetic. So it's all revolves around that correlated amount of muscle tissue I get to hold on to and to keep. Now, the point I didn't make on the first video, which is really critical, is the second half of this equation. The more sensitive muscle I have, the more the insulin that I use becomes that much more powerful. In other words, the less that I need. The less insulin that I need because of sensitivity, the better my health markers, which means my HDL goes up because I get to exercise. My LDL drops. My triglycerides drop. My cholesterol drop. My blood pressure drops. All that because of exercise. And this is the reason why this therapy is so important to me. I love to train, and I love to train heavy and hard. And because of him and what he's able to do, it helps with all those correlations so that I am as fit as I possibly could, even at the age of 46.
All right, this morning we got Jay here on the table. We're gonna start working on his shoulders, some of his rotator cuff muscles, his deltoids. We're gonna flip him over later and get some of his front shoulder muscles, his bicep tendon, some more of his deltoids. But the technique we're gonna use is cross-friction massage or cross-friction therapy. So what we try to do is find his scar tissue chunks or bumps. Once we do find, as with Jay right now, he's been getting treated, so it's harder to find because we've been sanding down a lot of his scar tissue, so they're a lot smoother. So once we find one, you'll probably see it on the camera where my thumb kind of jumps over like that. I don't know if you can see that, but that piece right there, that's a dense piece of tissue in his muscle. So what's going on is that muscle there did tear at one point, so this is evidence that there is remnants of a tear, so the scar tissue formed, and the scar tissue obviously creates the tightness and it blocks the blood flow to the muscle. So you get decreased performance again with the muscle and a lot more pain. So what we need to do to accomplish his great performance is break down the scar tissue. So all we gotta do is keep sanding away, and we're going against the grain. That's why they call it cross friction. So if you just go and flush it out with the grain, that's just like a myofascial release or active release technique, but we want to try to actually do some work here and break down that scar tissue so this muscle will heal normally and naturally. So it'll have its elasticity again, and also the blood flow. The blood carries oxygen to the muscle, so that's the fuel source. So if you have enough blood flow, that muscle performs so much better. It is somewhat painful, but Jay here is tough. You can take it.
You're not gonna hear me cry today.
Not on camera.
Not on camera.
How you doing, Jay?
Good.
Not too bad?
No, not at all.
All right, we're gonna go a little deeper, so we can use some tools. This way we can get more work done since his warm-up is over.
This is where it begins.
Yep. So scanning the whole muscle, just going through the whole muscle, seeing where you have scar tissue, and we'll just keep breaking down. All right, moving on to deltoids.
That one sits there. Okay. Okay.
Okay, break.
Whew.
Pretty good. You stretch it out. This arm back here. Keep your hand there. So now we're gonna hit the bicep tendon, and then kind of like transfer over to the anterior delts.
That's where I'm having the last of the scar tissue. That's the last of the stickiness right there. Yep.
Let's get to the deltoid. Our objective is to break down the scar tissue, so we go perpendicular to the muscle fibers. So this deltoid's going run down this way. We're going 90-degree angle towards or against that muscle. And this is showing Jay's progress. Before we could barely touch, his pressure was very low. We'd be doing this pressure right here and he'd be off the table. So now we've progressed to the point where we can just use tools and just go straight in, dig straight away. And ultimately your muscles shouldn't feel like they're flexed when they're rested. So if they're tight while they're at a resting state, that could mean two things. One, the muscle is spastic or in spasm, and or there's so much scar tissue that it feels like it's flexed, just so dense. So that's not how your muscle should be. Yeah, sometimes there's sweat coming out of your eyes, but that's it. No tears. No tears.
No tears.
It's not your tool to just kind of like polish it off. Loosen his muscles, relax his muscles. See, he doesn't feel like he's leaving with all this tension from all that pain. Not bad, huh?
No,
Alright.
it's not as painful as it sounds.
Yeah, that used to hurt you.
Yeah.
Not anymore. Now that just makes your muscles happy and relaxed. You know the pinches?
No. No.
One more thing. Move your shoulder this way. I'm gonna go behind your shoulder right here. And push straight to your arm here. Just relax. Oh, that's good.
Alright. Alright. So, you got a chance to see the therapy. And just remember, folks, it will be adjusted down in terms of intensity based on your degree of conditioning, your wants and needs. But as you can see, it is, for me personally, I've been training with weights since I've been 16. I'm 46 now, and I plan on going another 20 years. So furthermore, if you liked what you saw today, please hit that like button. It's so important for us small channels that are battling these big guys with wrote out scripts with production crews and paid positions. It's really important. So that like button, the subscribe button, and if you have any comments, please put stuff in the comment section. So have a great week and a productive week, and we will see you next week actually with an update of what the facility actually looks like. So I'll take you a tour of the whole place. All right, bye for now.